Hi, this is Dr. Kathy Farmer. I'm a psychologist at the Headache Care Center in Springfield, Missouri. And I'm very excited about presenting some slides and some information about thermal biofeedback, not only for migraine, but for health. It's important to know that pain produces two responses in each of us. The first response is a very quick response that goes to the cortex that measures the intensity, the location, the duration. For example, if you put your finger on a hot stove, you pull it away immediately knowing that my finger is hurt. And that is a somatosensory response to pain. But very seldom mentioned, there is a secondary response. And that response goes over more slowly than the initial. And it goes into the limbic cortex. The limbic cortex is a lobe in the central part of your brain. Also in the limbic cortex is memory and emotion. So when pain registers in the limbic cortex, in the limbic lobe, it alerts the entire body to that you are in danger. You must be alert. The world is a dangerous place. Now, by moving my finger off of the stove, there's a response that goes back to the body that says, you are safe. You do not have to worry. The fight or flight response is reduced. And for chronic pain, that is pain that occurs with migraine or chronic migraine or any other chronic pain syndrome, biofeedback is that response that goes back to the body to tell you you are safe. So the process of migraine really involves two different parts of the brain. One is the somatosensory, which is all the symptoms that are listed as indicators of migraine. The head pain, usually on one side, that pain is aggravated by activity, sensitivity to light and sound, and of course having an upset stomach, and maybe even worse, vomiting. But there is at the same time the limbic response, which is cloudy thinking, slow decision-making, unexplainable fear, irritability, lethargy, restlessness, vigilance, sadness. This is the limbic component of the pain response. And what does thermal biofeedback do? Thermal biofeedback means that you increase your finger temperature. The average finger temperature is 85 degrees. If you have a finger thermometer taped onto your finger, and the goal of thermal biofeedback is to raise that finger temperature to 96 degrees. And what does that do? Well, first of all, and very important, is when you take medication to actually be able to relax your system so your system receives the medication and makes it more effective. The second response is that it resolves this limbic response, the fear response to pain, that I have to be vigilant, I have to be on top of this, I have to be very suspicious of my surroundings. What I consider biofeedback is really theta training, and this involves a brainwave. Theta brainwave, for example, is the fastest brainwave we have, and it's a very good brainwave. It enables us to listen and pay attention and really attend to what's important. And this is important in in our schoolwork and achieving. However, people who are in pain, it's like wearing blinders. That's all they can think about. Will this pain ever stop? Will the medicine ever work? Will I ever be able to do anything but suffer? So what theta training does, it moves the brain from beta into alpha, which is relaxation, and then into theta, which is for creativity. Theta brainwaves is the area that's required to stop this. It's like an Indianapolis 500 thought wave. Like our culture says, okay, mind over matter. But really, the harder we try, it produces an Indianapolis 500 loop that's very hard to break. The harder we try, the more fast the thought loop is. So the only way to stop this is to go into theta brainwaves. And that's what biofeedback allows you to do, which breaks the loop, which helps you, it's the no pain zone, but it's also be able to find creative problem solving. So what is the migraine process? The migraine process is a predictable neurological progress. First, it starts with the vulnerability stage. That means something we all can predict about our menstrual cycle, or riding on an airplane, or hiking in the high altitude, or skiing. Something that's predictable, a weather change. So that tells you, uh-oh, I better be on alert for anything I do that would produce a headache. The pre-headache phase, of course, is the prodrome. And these are symptoms that each of us needs to identify on, uh-oh, a headache is right around the corner. For example, yawning, irritability, sort of the limbic phase. It's irritability, thinking, oh, I'm going to have to go to bed for 3 days, so I better hurry up and clean my house. That is the most effective phase to do biofeedback, because the whole progress can be stopped at any of these stages. So if you recognize your prodromal symptoms, you can do biofeedback at that stage, so the progress will be stopped. Some of us have aura, and then the headache phase is divided into mild, moderate, and severe. And according to early intervention, the most effective time to take your migraine medication is during mild. When you take your migraine medication at the mild phase, it's 86% effective. If you wait to moderate pain, it's 57% effective. If you go to severe stage, it's 33% effective. So you need to really see when what phase your headache is in, and then a postdrome, of course, is the hangover phase. And it's much like the prodromal phase: irritability, yawning, poor decision making. The important issue here is the migraine threshold. So ultimately, it's the interaction of the biology with the environment, but it's not only risk factors, it's protective factors too. So if we are knowing that we are going into a prodromal phase, that's when the protective factors need to come, especially also in the vulnerability stage. Protective factors are self-nurturing, such as things you really like to do, like hot tub, bubble bath, singing, dancing, bicycling, things that you really like to do, artwork, creative stuff, because that is what the theta brainwave is. So the tipping point is when the nervous system is really overwhelmed, usually by multiple factors. For example, a young woman who is approaching her menstrual cycle, whose child is sick and then has a deadline at work. Boom, that's when a migraine occurs. And of course, this is determined not only by genetics, but by the influence of the environment, which is epigenetics, those things around us that really affect how vulnerable our genes are. So what does thermal biofeedback do? It bridges the somatic sensory and the affective responses to pain. So it's a tool. It's a lifelong tool that gives you some control over migraine. So you do not have to be a victim of something that comes out from the, seems to come out from the sky and hit you on the head. Also, when you engage in thermal biofeedback with a psychologist, it's really a trusting relationship, so that you see that you are not alone, that people do understand what you're going through, and the psychologist and the clinician work together to find the best treatment plan for you. And it empowers the patient to really listen to his or her body, because so many times when there is pain involved, we automatically discount that body. For example, playing tennis. You get a tennis elbow, you ignore that body part because that body has let you down. And this is part of headache because it cuts you off at the neck, and the rest of your body you do not pay attention to. I mean, this is part of how to handle pain. So this is what's important, to really go into your body and listen to what your body's telling you about what needs to be done. So the education part of being a migraineur is understanding that a migraineur has a genetically predisposed, highly sensitive nervous system. And there's such a thing as a migraine threshold. So you need to not think of the headache. You need to think of your migraine threshold. What do I need to do to counteract my vulnerability to the next migraine? And that is self-nurturing activity. Activities to bolster the migraine threshold are self-nurturing, things you like to do, things that would be fun, identify risk factors, recognize prodromal symptoms, but most of all, to keep a headache diary, because our memory for pain is really poor. We just think of the last bad event. So if we keep a diary, we can actually measure what is it that really affects my nervous system. What is it that my hyperexcitable nervous system responds to? I do have a do-it-yourself biofeedback CD-ROM. It's at www.headachecare.com. You click on Click Services, and it's my CD with 4 visualizations and a finger thermometer. And in it explains how to do this. I believe that this is applicable to about 80% of people with migraine. I think it's very important for people with migraine to recognize that, yes, there's a negative aspect, which is, of course, the headache. But there's positive characteristics. And I see this all the time. These are my patients. I see them. Highly conscientious, detail-oriented, extremely intuitive. I don't think they realize how intuitive they are, and it's a very positive thing. They tend to be perfectionistic. Realize, and that's the #1 affirmation I give to my patients. I forgive myself for being perfect. None of us is perfect, none. Worries a lot, very creative, and that's where the theta brainwave comes in. Because every time you do something creative, like singing, dancing, artwork, arts and crafts, your brain goes into theta, which is the no pain zone, and which is the direction we want to go in biofeedback. Often migraineurs have a hard time saying no. They want to live up to other people's expectations, and they think if they say no, they're going to be rejected. Also, a migraineur often puts his or herself last. It's difficult to set boundaries, and very afraid of how to express anger. I explain anger as if someone steps on your feet, you push them away and say, I'm angry that you stepped on my feet. It's not a drama. It's just saying, I feel angry at what you just said to me. So what actually is thermal biofeedback? You tape a finger thermometer on your index finger. Usually, often, migraineurs have a finger temperature in the 70s. The average finger temperature is 85. The goal of biofeedback is to warm your finger temperature to 96 degrees, which puts you in the theta brainwave zone. And how do you do that? You do that through listening. I do the visualization, or sometimes people just listen to their favorite music, which is calming, listening to nature, sounds of a train or rain, anything that helps you relax. Because the goal is to replace the fight or flight response, which is the limbic response, with the relaxation response. You're actually toning down your natural physiological response. Biofeedback it is really putting conscious control over an unconscious process. So the fight or flight is immediate. It is not learned. It's instinctive. So what we do is we tone down through practice is a tool, how to tone that down so that you can respond to stress with relaxation, because fight or flight really wears down the body's ability to cope. It also modulates the hyperexcitability of the brain, so it tones it down and it balances the nervous system. So let's see about the cosensitization of the nervous system and the limbic system. Why is this important? Okay, this is change over time. This is the normal neurological base. Okay, here's a migraine. This is an episodic migraine. The episodic migraine goes up to a neurological dysfunction and then returns again to normal. What is the limbic reaction? Before it returns to normal, the limbic reaction is worry, concern, anxiety, because these two work together, the somatosensory reaction to pain and the limbic response. Okay, let's say then something very traumatic happens. Okay, so like you break a leg, for example, skiing. All of a sudden, the migraine becomes much more frequent, and there's no return to the normal neurological basis. And then what happens? The limbic reaction is a sense of being overwhelmed, fearful that they'll never be healed, hopeless, and desperate. And you can tell in your own language how much there is a limbic component to your migraine. And the limbic component is, my headaches are killing me. My headaches weren't a problem until my life revolves around headaches. This is a predictor of poor response to pharmacological intervention. Why? Because the limbic response is not readying the body to receive the medication in an effective way. And it's the language that expresses this effective component. And it's a cue. It's a cue to me when I hear my patients talk this way, but it could be a cue to you to understand the limbic component to your migraine. And this is not a blame. This is just a realization that somehow this limbic component needs to be resolved. And I believe that's through biofeedback. So limbic healing is alert. The alert response is turned off. There's a plan of action, and there's an experience of control over the event. So oftentimes you do need to talk to a professional. Not always. You could find this out for yourself by listening to the CD or nature music or some other relaxing music or a movie that you really like and that you just can lose yourself in. So the two questions I think that are most important to ask is, why are you seeking treatment at this time? Of course, we're in a called a tertiary headache center. So these are migraineurs who usually have chronic migraine and who really feel a sense that nothing works. But it's important to establish a goal. What is my goal? The goal is to feel some control over this episode of migraine, and the best way to do that is through biofeedback. Another important question to ask yourself, what else was happening when my headaches became more frequent? So these points are very important because often most of us are not aware. We live our life every day. We don't see these points that are very important to our own health. What else was happening when my headaches became more frequent? So thank you. That's the end of my presentation, so I welcome all your questions.
Dr. Farmer, can you hear me?
Yes?
How can a biofeed, I'm sorry, the first question comes from Carol, and she wants to know, have you ever seen where biofeedback is used as the alternative method and it's the only form of treatment for migraine, as far as the patient getting rid of their medication in order to only have this one treatment?
Yes, I have seen it. Yes, I have seen this with children. Children as young as 5 can actually stop a migraine through biofeedback. Also, I have had pregnant women who cannot take medication come to me and they find biofeedback, thermal biofeedback is a very effective tool to control their migraine during pregnancy.
Thank you. Our next question is, are there any other types of biofeedback that can be helpful besides thermal?
Of course. Yes. Yes, there are. The reason I choose thermal, I was trained at these big machines, and a patient would come in and there's EMG biofeedback, with the electrode is put on the frontalis muscle on the forehead, and then there's thermal biofeedback, which would be, it's a thermistor that's put on the index finger. I chose thermal biofeedback. It's the finger thermometer is a very simple cardboard thermometer with mercury in it, and what it is, it shows a person how well they control their physiology. If you think of negative thoughts, the temperature goes down. In fact, finger temperature is part of the polygraph test. So if you tell a lie, your finger temperature goes down. And if you think of negative thoughts, your finger temperature goes down. So that helps an individual identify the thoughts that are really setting them up for migraine. And a lot of these thoughts come automatically, like you're stupid, you're fat, you're ugly, things that we all hear as a kid, or bullying, or, being teased, or whatever. And so when you see that, you realize, wait, I have to replace this negative self-talk with affirmations. And the affirmations, besides, I forgive myself for being important, I forgive myself for being imperfect, with I'm I am lovable, I am worthwhile, I deserve health and harmony. And those are the three major ones that I give my patients. So yeah, I also have done EEG biofeedback. EEG biofeedback is it's much more elaborate. You have to put electrodes on a person's scalp, and it's effective. I would just say in 10% of pain patients. I used to treat pain patients for 7.5 years, and they're more difficult to treat than migraine patients. So I rarely see a migraine patient that needs EEG biofeedback.
Thank you. It looks like everyone's posing the same question as far as the temperature of your index finger. How long do you want to keep that temperature in your finger?
Okay, this is a very important question because the longer you keep your finger temperature warm, and I'm not saying it has to be 96 degrees, but just 90. I mean, I say 90 is relaxation, that's alpha brainwaves. 96 is theta. But if you take your finger temperature, for example, every morning, and it's 90, 90, 90, and then all of a sudden it drops into the 80s, that's telling you that your body is vulnerable for a migraine. Why? Who knows why? We don't know why. I have done a study with children between the ages of 8 and 12, and this was a reliable, they were not taking any medication, and it was a reliable indication that they were about to have a migraine. And so they would show their teacher in the classroom, my finger temperature just went down. I had to go to the nurse's office to practice biofeedback. And so it was an external verification that a migraine was about to occur. And I think that's a lot of what migraineurs need to know, because so many that I talk to say, oh, you know, this was just a one-time occurrence. I'm never going to have another one. You know, it's a matter of will. It's not a matter of will. It's a matter of neurology, a neurological episode that, for some reason, the physiology gets overwhelmed, and boom, pushes you in bed. So it's very important to keep in touch with your finger temperature. Now, not all people who teach biofeedback believe that, but I firmly believe it, and the reason I do is because I actually have seen it in our studies.
Thank you. Our next question, how many visits are recommended for with someone who has training in biofeedback?
My average is 3 visits. But of course you have to practice. I mean, that's the downside, and I hear this from physicians all the time. Well, how are you going to motivate a patient to practice so that they get good at it? And my answer to them is because they see the results. I mean, they feel better. They get insight. You know, I mentioned earlier that one of the traits, I mean, there's been a lot of studies about personality of a migraineur. It's never been found. But there are traits, and one is putting him or herself last. So when I say to them, you need to practice this once a day, that's 10 minutes that they have to focus on themselves. And that's very important, because that's so many times a migraineur just gives, and doesn't replenish himself or herself. So this 10 minutes is very valuable, and not only calming the nervous system and reducing the vulnerability of another attack, but also realizing that I am important.
Thank you. Our next question comes when you talk about patients seeing the results. Would you say that a CD is sufficient to use, or would you have to see a trained professional? Would you say that the CD is sufficient for use, without seeing a trained professional?
And what's trained?
As far as the patient.
What's a trained professional?
A trained professional in biofeedback. They're wanting to know, so a couple of people have asked, would the CD be enough for them to get through biofeedback?
I'm sorry. I get it now. Okay, yeah. I estimate that we stage migraine patients, and stage 1 is a person who, has 1 or 2 migraines a month, and they respond to migraine-specific medication. Stage 2 is when it becomes more frequent and their medicine doesn't work as well. So what I would say is that in stage 1 or stage 2, these individuals can teach themselves biofeedback and do well. The problem is that a lot of times they can't find, a young mother with kids, I mean, where are you going to find a place? I mean, sometimes they have to go into the bathtub, when the kids are sleeping or something. So how, when you can have 10 minutes to yourself? I mean, that's a problem. And, yeah, I firmly believe that people could teach themselves this. And that's why I did the CD. And the finger thermometer, it's inexpensive, it's portable, you can carry it anywhere. So you can actually, I ask people, okay, when you're home, like on a Saturday, put this finger thermometer on your finger and actually judge what pushes your finger temperature down. And, one woman, she'd never realized it, but every time the phone rang, her finger temperature went down because she thought it was her mother-in-law. So, I mean, these are the things. It's really a matter of self-discovery. That's what it is.
I read that some abuse survivors show a paradoxical drop in temperature as they relax. Why would someone, can you speak
well,
to how that?
That means that the abuse needs to be resolved, addressed and resolved, and I do that too. And that's way beyond biofeedback, because that is regressive psychotherapy. But yeah, I do that a lot with pain patients. In migraine patients is not as common, but when that occurs, anytime the finger temperature goes down, there's something negative there. There's some negative thoughts, some negative memories, and the therapist has to be aware of that. And what I usually say is, did I say something to upset you? Your finger temperature was 80, it went down to 70. What were you thinking? Do I remind you of your mother? Anyway, so it really needs to be addressed, because that's a very serious sign.
Thank you. Our next question, do you recommend practicing biofeedback daily and not only when you're in the prodromal phase?
Yes. In the beginning, it's important to do it daily because it becomes a habit. And eventually, with biofeedback, I recommend putting a symbol in your mind of something relaxing. So you associate a picture in your mind. I'm a visual person, so that's why I say this. A visual symbol in your mind with relaxation and warming your finger temperature and your toe temperature. And so if you're in a stressful situation, you can put that symbol in your mind, and immediately the body goes into relaxation. So you don't need a finger thermometer. You don't need a CD. You don't need to lay down and relax. So the more you practice, it becomes a habit. And that's the goal, is to make it immediate. And that's why biofeedback leads to health. Because every time you're stressed, your body immediately goes into a relaxed mode so that you can think clearly and make a creative decision.
Right. This doesn't happen that often, but it seems everybody has the same question. Is there a listing of biofeedback trained professionals that they could go to find a professional in their area?
Yes, there's a. Unfortunately, I don't belong to this organization, but I do respect that. I have spoken for this organization. It's called. It's Psychophysiology and Biofeedback Professionals. I would just go Google biofeedback professionals, and it will come up. It's a respected organization, and you pass a test to do that. The downside of that is, I mean, I learned biofeedback from a person who was treating symptoms. For example, a type A personality, trying to teach a type A personality to be more relaxed. But when you're dealing with pain, it's much more complicated. So it's really important when you interview a biofeedback specialist to ask them, do you deal with pain or migraine?
Our next question, if a person also has Raynaud's disease, how does that affect the ability to increase finger temperature with biofeedback?
It's perfect. It's perfect. I have treated people with that. And what better way to treat that but to make the blood vessels in the fingers warm? It really works. I've also done diabetic neuropathy of the feet. It really works. That was when you do toe temperature, raising the toe temperature to 93, and this individual was he couldn't play golf anymore. He felt like he was walking on stumps, and after a period of time, I mean, it's not instantaneous by any means, but he really worked at it, and he was able to play golf again. So it's perfect. That's a perfect way to help that problem.
Can you speak to this comment? It says some chronic pain patients show a perplexing and paradoxical increase in temperature to cognitive stressors.
I don't really know. I don't really know what that question is getting at. What I think of, and I don't know if this person means this, 60% of people respond to stress cardiovascularly. That means your finger and toe temperature go down because that's a fight or flight response. But there's 40% of us who respond to stress muscularly. So that means regardless of the amount of stress you're under, your fingers and toes are warm. So that means the EMG biofeedback is more effective. And what I do for those people is that with the EMG biofeedback, you put an electrode on the forehead, the frontalis muscle, and you have it's the same procedure. You just have that person visualize reducing the microvoltage of that muscle. Now, with EMG biofeedback, you have a register that shows you the microvoltage. So like if it starts at 99, you want the individual to reduce the microvoltage down to less than 1. Once they do that for the frontalis muscle, then you move that electrode to the muscle. Usually, of course, in the pain, it's usually pain, to that muscle and the pain that's causing so much pain in the back. And then they are taught, they use the same relaxation technique, but the same visualization, but the goal is to visualize reducing the microvoltage in that muscle in the back. And that works very effectively too. The reason I don't use EMG machine is because people have to come to the clinic to do that. And so, you know, they can't practice every day. So what I do is I ask them to put a Band-Aid on the muscle and then use the same visualization techniques. Of course, they don't have the microvoltage feedback, but they do have the propensity to lessen the microvoltage in that painful muscle.
All right. Looks like our last question is, will biofeedback still work even if you are in the active pain phase? For example, if you wake up with a migraine in the morning and you try to do biofeedback, will it take effect?
No, probably not. I mean, with a morning, a migraine that wakes you up in the morning is usually, yeah. This is an interesting case, and I don't know if this is appropriate here, but somebody who has frequent migraines in the morning, they usually have a bad dream, and what I ask them to do is do biofeedback every night before they go to bed. And my example is, this is a young man who had this awful dream, and he was a professor at a university, and he had this awful dream that he was holding on, like he was in a field house, and he was holding on to a bar in the middle of the field house, and he couldn't hold on anymore, and he fell, and then he would wake up with a migraine. And so what I said to him, of course, this is lucid dreaming, I said to him, well, why don't you put a safety net under you? So he did that. He did biofeedback before he went to bed, and then in his mind, he said, I'm going to put a safety net under this dream, and he lessened, I mean, it wasn't erased, but it lessened the frequency of these excruciating morning migraines. Yes, I mean, these are the things that we just don't understand, and it's connected to the limbic system, and the limbic system is trying to give us messages that we don't really understand, and they're not logical to us. But if we listen, we can come up with a solution, and that's how I see my role.